My name is Dr. Rifa Siddiq. Welcome to my channel. I hope this will help you. Today I'm talking about memory problems. It's mostly happen in elderly, but these days we are seeing in younger people also. So what are some of the key findings or key symptoms we see in this memory problem or memory issues? Mostly it's age related, and also it's diet related or stress level. That is why we are seeing in the younger people also. When we see in the age related, still it's kind of as we are growing older, our brain cells are not that in a good shape as we had our brain cells when we were younger. So it is still, we expect that we will lose some of our memory. But some people don't lose memory. Even my father, when he was 95 years old, his memory was 100% intact. So there are some things which we can do to make our memory intact. So if you are seeing that your elderly parents or your loved one around you are started having some problems, they start forgetting the names, they start forgetting their keys, or little things. So don't ignore that, because if we start picking these symptoms early, if we start doing things, checking things on them early, we can actually still treat them. There are some medications, there are some food items which we can introduce to their diet, and the memory will either come back or we can stop the deterioration. So that's very, very important. So age-related memory. Then we go to the next level, which is a little bit on the high. Memory is like now is more worsened. So that is why you will see that your cognitive impairment is a little bit more than just forgetfulness. So that is serious, because this one definitely will lead to Alzheimer's or dementia, full-fledged dementia. So here we can introduce some medications which can actually again slow the progression of the disease. Sometimes there are some causes to these problems. There are other medical problems which are actually causing it, like Parkinsonism disease or some other issues patients are having and which are leading to the memory problem. So we need to treat those first also. Many times we'll see that chronic medical problems are causing, they can be one of the cause of dementia. So we need to have a full workup. You need to see the doctor who can sit down with you. You need to see neurologists who can also do extensive tests on you, so we can stop that, because now the next level is full-fledged Alzheimer or dementia, and that can be very, very dangerous, because what happens, people stop actually comprehension is affected. Their daily tasks they cannot do, like they will forget little things, even how to eat. Even at time when they are at an advanced stage, they will actually also forget to go to the bathroom. So now they are incontinent of urine, incontinent of stool, and also the most scary and most sad thing is when they stop eating. So that is, they don't know, they don't know how to chew, because there is no connection between brain and the body and the rest of the body. So we need to avoid these things, and we can do it. How we can avoid these things is, when it start, you see that when a person start with the little things like forgetting the name of a person or forgetting their keys, that is where you need to start acting. Go and see the doctor. They will do full-fledged exam, brain, your mental, they call mini mental, that we should do it every year. Above 65 or any time you're having memory problem, we should have this mini mental exam every year. So that will tell you how your memory is it fine or it's getting worse. So that's very important. Some of the diet we can actually add in our food, in our daily, that is very important. I would advise people to have almonds, because almonds have a lot of antioxidant. It is extremely good for our brain. We need to add those in our diet. Eggs are very important. 2 or even 3 eggs every day, organic egg. They are full. Their protein is so good. That's really will be helpful for our brain cells. And also the yolk has all the minerals and vitamins. So we need to add those in our diet. That will help. Another very important thing you can add in your diet is fennel seeds. Fennel seeds are very good in vitamin B, or you can add vitamin B complex to your diet. But when you take multivitamins in forms of pills, the absorption is very little. But when we take items in our diet, the absorption is much better. So try to take green vegetables, which has a lot of vitamin B. So that's very important for our brain cells. Because in dementia and memory loss, our networking is the problem. So the networking from the brain to the rest of the body, that wires get problem. So it's kind of an IT terminology. Networking is a problem. So we need to add these items to our diet. Also, we need to eat healthy. Less carbohydrate will be also helpful, because it will be very good. Also, you need to go to the doctor, and there are some medications which we can start early on, so it will stop the disease progression, so it will at least slow down the disease. So I hope these tips are helpful. Thank you so much.